Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Tetanus. Introduction. Tetanus is a serious illness caused by bacteria. The bacteria live in soil and dust. They can also be found in saliva and manure. The bacteria can get into the body through a deep cut. Tetanus causes the muscles in the body to tighten. It can cause pain and threaten your life. You can prevent the infection by getting a shot. This shot is called a tetanus vaccine. The vaccine is given to children. Adults need to get the shot again every 10 years. This program explains tetanus. It covers symptoms and causes of the infection. It also covers diagnosis and treatment. There is also a section that talks about how you can prevent it. Tetanus. Tetanus is a serious illness that can be life-threatening. It is caused by a certain type of bacteria. Tetanus causes muscles in the body to tighten. It can affect muscles all over the body and cause severe pain. Sometimes tetanus is also called lockjaw. This name comes from a symptom of the infection. Lockjaw is when a person can't open his or her mouth or swallow. Tetanus can lead to death. It causes the muscles in the neck and mouth area to tighten. This can keep a person from breathing and getting the oxygen his or her body needs. You can prevent tetanus by getting a vaccine. A vaccine is a shot that helps protect your body from a disease. One type of tetanus happens in newborn babies. This is called neonatal tetanus. It can happen when a baby is delivered in an unclean place. Neonatal tetanus is rare in developed countries where many women have gotten the vaccine. They pass some of the protection to their babies while they are in the womb. Tetanus can be treated, but treatment does not always work. It is much easier to prevent the illness. Symptoms. Symptoms of tetanus often start 7 to 8 days after the bacteria enter the body. However, it may take many weeks or months for symptoms to appear. Tight jaw muscles are the first symptom of tetanus. The muscles may spasm or twitch. Tetanus can then affect your neck muscles and cause swallowing problems or make it hard to breathe. The muscles in the rest of the body may be affected by tetanus. Tetanus can cause muscles in the shoulders, back, or stomach area to tighten. It can also affect the muscles in the upper arms and thighs. Tetanus can also cause muscles all over the body to spasm. This can be very painful. The spasms may start if an infected person hears a loud noise or feels a draft in the room. Tetanus can sometimes affect only one area of the body. The affected area is often close to where the bacteria got into the body. However, this type of tetanus is rare. Tetanus can also cause fast heart rate, fever, high blood pressure, sweating. Talk to your healthcare provider if you have these symptoms. This is especially important if you have gotten a deep cut in the past few weeks. It is also important if you do not know when you last got the tetanus vaccine. If tetanus is not treated, it can lead to death. The muscles of the chest can experience severe spasms, causing the infected person to be unable to breathe. Tetanus may also cause death by affecting the heart, blood pressure, and brain. Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials. Causes. Tetanus is caused by a type of bacteria. The bacteria are called Clostridium tetani. They are found in soil, dust, and animal waste. They can also be found in saliva. The bacteria can enter the body if you have a deep cut or wound in your skin. This can cause you to get tetanus. The bacteria can also enter the body if you have a wound that has been caused by a dirty or reused needle, been contaminated with soil, saliva, or animal waste, dead tissue such as a burn or frostbite. Once the bacteria enter the body, they make a toxin. A toxin is a poison made by cells. The toxin made by tetanus bacteria is called tetanospasmin. This toxin affects the nerves in the body. It causes the muscle spasms that are a symptom of tetanus. The toxins can spread throughout the body. They spread through blood vessels and lymph channels. This is why muscles all over the body can be affected. In severe cases, tetanus can lead to death. Diagnosis. Your healthcare provider will do a physical exam. He or she will also ask about your medical history as well as your symptoms. Your healthcare provider will also look at your vaccine history. You are more likely to have tetanus if you have not gotten the vaccine. You can also get it if you have not had a booster shot in the last 10 years. Lab tests are not helpful when trying to diagnose tetanus. The diagnosis is based on your symptoms. It is also based on your vaccine history, but other tests may be used to rule out other causes. Treatment. There is no cure for tetanus. However, supportive treatment can help an infected person manage his or her symptoms. Treatment may include medicines to reduce symptoms, wound care, hospitalization. Medicines that may be given to treat tetanus are antitoxins, antibiotics, sedatives. The bacteria that cause tetanus release a toxin. Antitoxins are medicines that are used to fight toxins in the body. They may be injected into a vein or muscle. The medicine stops the toxin from spreading to other parts of the body. Antitoxins only work on toxins that have not attached to nerves. Once the toxin has attached, it can take months for that nerve to heal. Antibiotics are often given to treat bacterial infections. They can make the time you are sick shorter. Your healthcare provider will tell you how to take the antibiotics. He or she will also tell you how long you must take them. The infection can get worse if you stop early. Doctors generally prescribe powerful sedatives to control muscle spasms. Sedatives are used to calm the muscles. Muscle spasms may continue despite treatment. You will also be given a tetanus vaccine. The vaccine can prevent future infections. Without a vaccine, you can get tetanus again even after you recover from a previous infection. Your healthcare provider may recommend other medicines to help control your heartbeat and breathing. They may also help reduce pain. Treatment also includes wound care. Wound care is cleaning the wound so the tetanus bacteria will not grow and spread. Any dirt, objects, or dead tissue will be removed. Tetanus is often treated in a healthcare facility. You may need to stay until you are better. This allows your doctor to watch you carefully. You may also need to use a ventilator. This is a machine that can help you breathe. Even with treatment, tetanus can cause disability for life. It may also cause brain damage in babies. In severe cases, it can lead to death. Vaccination. A common childhood vaccine can prevent tetanus. A vaccine is a shot that protects people from some diseases. The DTaP vaccine protects against tetanus. It is often given at these ages: 2 months, 4 months, 6 months, 15 to 18 months, 4 to 6 years. Talk to your healthcare provider to learn more about your child's vaccines. Ask about any side effects they may cause. People need vaccine booster shots later in life. This is because the vaccine loses strength over time. A booster shot is needed around age 12. Another booster is needed every 10 years. You may also need a booster shot if you get a deep or dirty wound and it has been more than 5 years since your last shot. Ask your healthcare provider if you need a shot before you travel. Tetanus is more common in some areas. If you like this video, please like and share. For similar videos, subscribe to our channel. Summary. Tetanus is a serious illness caused by bacteria. The bacteria live in soil and dust. They can also be found in saliva and manure. The bacteria can get into the body through a deep cut. Tetanus causes the muscles in the body to tighten. It can cause pain and threaten your life. You can prevent the infection by getting a shot. This shot is called a tetanus vaccine. Adults need to get the shot again every 10 years. Lab tests are not helpful when trying to diagnose tetanus. The diagnosis is made from your symptoms. It is also made based on your vaccine history, but other tests may be used to rule out other causes. Treatment may include medicines to reduce symptoms, wound care, hospitalization. Even with treatment, tetanus can cause disability for life. It can also cause brain damage in babies. In severe cases, it can lead to death. Getting the tetanus vaccine is very important to prevent the illness. Thank you for using Explain.